You're listening to Boomers Today with your host, Frank Sampson.
Well, welcome to Boomers Today. I'm your host, Frank Sampson. Of course, each week we bring you important and very useful information on issues facing baby boomers, their parents, and other loved ones. And as I do every week, I want to thank all of you for listening in, sharing our podcast with friends and family, and our listeners are growing each and every week, and it's because of you. So I just want to thank you. Many of you listen to the show on Apple Podcasts, Google Podcasts, Spreaker, Stitcher, iHeartRadio, and some of you go directly to our website at boomerstodayradio.com. So thank you so much for that. I know why you are listening in, and I know why our listeners are growing each and every day. It's because we have great guests, a lot of wonderful information, and we're not going to disappoint you today because we have with us Gary Small, who is a MD, is Chair of Psychiatry at Hackensack University Medical Center in New Jersey. Dr. Small is also the co-inventor of the first PET scan method that provides images in living people of the physical evidence of Alzheimer's disease. In addition to testing compounds that may benefit cognitive abilities and possibly delay the onset of Alzheimer's disease symptoms, Dr. Small has studied and developed lifestyle and memory training programs for improving cognition and healthy aging. Dr. Small has co-authored over 500 scientific works and received numerous awards and honors, including the American Psychiatric Association's Weinberg Award for Excellence in Geriatric Psychiatry. Scientific American magazine named him one of the world's top 50 innovators in science and technology. He is also the author of 12 popular books, including the New York Times bestseller, The Memory Bible. So, Dr. Small, thank you so much for joining us. It's an honor to have you on our show.
Thank you, Frank. I'm delighted to be joining you today.
Yeah. So, we were talking a little bit before we came on. And I mentioned I'm in the industry, in the senior care industry. I work with a lot of families whose loved ones are dealing with various types of dementia, like Alzheimer's. And I hear it often, does this mean I'm going to get it? My mom has Alzheimer's. Maybe you could just enlighten us a little bit on your studies as far as the non-genetic factors as well as the genetic factors.
So this is a very common concern people have. If you have a loved one who suffered from Alzheimer's disease, you're worried that you're going to get it, that there's some kind of a genetic component. And in fact, if you're just having everyday senior moments or middle-age pauses, that has a different meaning if you've seen someone close to you gradually decline from this horrible illness. And yes, there is a genetic component. There is a certain genetic risk. If you come from a rare family where half of relatives get the disease, and they usually get it around the same age, you might want to get genetic testing. You may want to go to a genetic counselor to find out if you have a genetic mutation causing the disease. Now, not everybody wants to know that, but some people do. That accounts for only less than 1% of cases. More commonly, there are what we call genetic risks, and that means that you carry a common genetic form or allele that increases your risk for the disease, but is neither necessary nor sufficient to get it. So for the average person, we don't recommend getting genetic testing because that kind of information isn't enough to tell you if you're going to get the disease. It's not an actual error in your DNA or your genome. So the bottom line is, if the greatest risk factor for Alzheimer's is age. So by age 65 or older, the risk is about 5, maybe 10% at most. And if you have a close family member with the disease, that might double your risk at that older age. That would, may mean only 10%. So it's not that great an effect. And in fact, for the average person, non-genetic factors have a greater impact on how well your brain ages.
Yeah, very, very interesting. When I was introducing you, and I mentioned that you're a co-inventor of the first PET scanning method that provides images in living people as far as the physical evidence of Alzheimer's. I guess I was, and I think many people are just under the impression like there's really no way to 100% determine if somebody has that disease while living. Is that still true?
Well, I think, it tends to be an issue of semantics, I think, because, with the diagnostic tools we have today, we have a pretty good idea that there's a problem. Now, having said that, if you follow people to autopsy who had a diagnosis of Alzheimer's disease, and you look in their brains, a lot of times it's not just this physical evidence, what we call amyloid plaques or tau tangles. These are the abnormal protein deposits that accumulate in areas of the brain that control thinking and memory. You'll also find evidence of small strokes. You'll find evidence of head trauma. So the brain undergoes a lot of wear and tear as we age. Still, for the issue is, if you have a cognitive problem, it's important to see the doctor to find out what's going on, because sometimes it could be a medication side effect, it could be a medical problem, thyroid imbalance, and it may not be Alzheimer's disease.
Right. So let's talk a little bit about some of the areas that you recommend where we could deal with the disease better. All right. So, we hear it all the time: physical exercise, diet, etc. So even though we talk about that all the time, we can't talk about it enough, but maybe you could expound upon it a little bit.
Well, before I get into that, I want to, because you said deal with the disease, and I just want to talk about that a bit more, because
Sure.
When we talk about the disease, some people define it as just the buildup of these abnormal protein deposits, which you can see in the brain with PET scans, maybe decades before people actually have more profound cognitive decline. Now, if you have that more profound cognitive decline where it interferes with your daily life, then a medical evaluation is important, because there are medicines that help with the symptoms that have been around for quite a bit of time. They don't cure the disease, but they help people stay at a higher level of functioning longer. Now, when we talk about the non-genetic approaches, the lifestyle behaviors, that's something important for all of us, no matter what stage of our cognitive function. In fact, I recommend living a healthy brain lifestyle when you're a child, when you're a teenager, because you develop these healthy habits. It's going to be easier to maintain them than try to break bad habits when you're older.
Right.
And so, number one is physical exercise. The scientific evidence is probably the most compelling in that area, that if you maintain a regular regimen of physical exercise, your brain will be protected to some extent from cognitive decline. And you don't have to become a triathlete. Some studies have found that just 20 to 30 minutes of brisk walking every day lowers a person's risk for Alzheimer's disease. And what's going on is that your brain circulation is improving, your heart is pumping oxygen and nutrients to your brain, you're producing brain-derived neurotrophic factor, or BDNF, which is almost like fertilizer for your brain cells. It causes the branches of the cells to grow, and so your cells communicate more effectively. Your brain actually gets bigger in certain areas that control memory under the temples in the temporal lobe, very important memory centers. So regular physical exercise is very important, and it's not just the cardiovascular conditioning as we age that's important. Strength training is critically important to maintain lean muscle mass, and balance training, because we know that as cognition declines, people tend to get unsteady on their gait. And if you fall, you break a bone or you hit your head, that's going to really set you back.
Yeah. So, I was going to say, people that are, let's put it in the category of the 65 and older, and they want to do whatever they can and fix physical exercise, like you're recommending. But maybe they've had knee replacements. Maybe they've had hip. A lot of people at that age are going through that nowadays, and they go, I just can't. I can't do these walks, or I can't. So, what do you recommend to those people who want to do some form of exercise but have some physical challenges?
Yeah, I think it's a question of adapting to your limitations. The people who age well, the key to successful aging is coming to terms with the physical and mental challenges of aging, and you develop workarounds. So let's say you sprained an ankle and it's not healing as fast as it would have healed when you were in your 20s. You can't take your daily walk. Well, maybe swimming is the way to go, or maybe get a stationary bike, or even if that's stressful, you can get a hand bike, one of these things that you use your arms to get some kind of cardiovascular workout. So there's lots of ways to accomplish the end result without giving up.
Let's talk a little bit, if we can, about drugs, drug development as it relates to Alzheimer's or other forms of other types of dementia as well. What's going on nowadays? I mean, we hear about new drugs coming out all the time, and then everybody gets kind of excited, and then the next thing we know, well, it's really not working that well, and we hear it all the time. Can you give us kind of an up-to-date of where we are today with drugs and other medicines?
Well, Alzheimer's disease is a complex disease. It affects many different cells in the brain. So some of the early drugs that were developed were drugs that increase the availability of a certain brain messenger called acetylcholine. And these drugs were cholinesterase inhibitors. So they inhibited an enzyme that broke down that brain cell messenger. And they're helpful. They have some side effects, but routinely we prescribe them. And these are called symptomatic treatments. If your doctor starts you on one of these medicines, and another medicine that's a symptomatic treatment is called Namenda or memantine, and it has a similar effect, and it can be given with one of the cholinesterase inhibitors such as donepezil or Aricept or rivastigmine. And you may or may not see any benefit, but as long as you tolerate the side effects, it's a good idea to stay on it because it'll keep you at that higher level of functioning. The drug development has been targeting what they call disease-modifying treatments, where it really affects the underlying disease. Now, one way to understand this is if you had pneumonia, a symptomatic treatment would be taking an aspirin because that would make you feel a little more comfortable. You have to keep taking the aspirin to get that comfort level, and it wouldn't cure the disease. You need to take an antibiotic, a disease-modifying treatment that's specific for the bacterium that's causing the pneumonia. So that's where the drug development is focused. And I mentioned earlier the amyloid plaques and tau tangles. Much of it has been targeting these amyloid plaques to try to clear the brain of amyloid. Now, the problem with that is there is some controversy as to whether amyloid is causing the disease or is it an end result of some other disease process. And what you find with a lot of the studies is that if you do a brain scan, you find that that new anti-amyloid drug clears out the amyloid, your brain looks better, but it doesn't have such a big impact on the disease, on the cognitive problems. So I think this is some of the limitations we're seeing, and there's been some other hiccups along the way. One of the first of these anti-amyloid drugs that was developed had data that was not all that compelling. And so the doctors or the experts who were looking at the results of the studies were not so convinced that the drugs were all that helpful. And as a result of that, even though the FDA cleared the first drug, aducanumab, the Centers for Medicare and Medicaid Services, the group that decides on whether Medicare will pay for the medicine, they were not as enthusiastic about the drug. And so it's really been abandoned because the insurance carriers are not paying for it. So very few people are taking it. There's a new drug that has been approved by the FDA. The question is, what will CMS do? There's concern that even though it has some effects, it definitely clears out the amyloid and has some cognitive effects, that it also has a lot of side effects, and it's expensive. So this is the situation we're in. In the meantime, there are other approaches that scientists are using, such as devices that can stimulate neurocircuitry in the brain. We're planning a study of one of these devices at Hackensack Meridian Health in the next week or two. We'll start that study. There have been studies looking at lowering inflammation. A number of years ago, I did a study with an anti-inflammatory drug in people who don't have dementia, or not that cognitively impaired, but have some forgetfulness. And we found that it was better than placebo in helping cognition. But the problem with these anti-inflammatory drugs is that they have a lot of side effects. And when they're studied in people who already have dementia, they definitely don't work, and sometimes they can make matters worse. So our group has been looking at safer forms of reducing inflammation. We've studied a bioavailable form of curcumin, and curcumin is a component of the spice turmeric, and it has fewer side effects, and it seems to have a cognitive effect. We're going to plan to try to replicate that study at Hackensack Meridian, and also in collaboration with my colleagues at UCLA. So there's lots of different approaches. It's frustrating because it is a complex disease, but I'm cautiously optimistic that we're going to make some breakthroughs in the next 5 to 10 years.
Actually, you just said in your last statement question I was going to ask you. I was going to say I was going to put you on the spot, but you offered the information, and that is
what was that?
What's your hope here? I mean, you are very close to it. This is what you do every single day. For those that are worried about it in their own future, for those that already have the disease, they have a family member. I mean, what can you tell them? What's your hope? I mean, when you say there could be, I don't know, I can't remember your exact words, but maybe in the next 5 to 10 years, some positive results. What type of positive results are you hoping for?
The positive results would be some drug or intervention that has a more significant impact on the disease and has fewer side effects. In the meantime, it's so important that we help people understand that a healthy lifestyle, particularly early on in the game, will stave off or delay the onset of symptoms. We talked about physical exercise, a healthy diet like a Mediterranean-style diet, stress management, staying socially connected. And these are important measures that will help all of us. When I do an evaluation of a patient, I not only look at the medical issues. What are the medicines the patient's taking? Are there any diseases might be contributing to the problem? But what is their lifestyle like? Are they getting an exercise routine in there every day? Are they eating right? Are they staying connected with others? So there's a lot we can do. People don't realize they have more control than they expect.
So, Dr. Small, we're going to take I promise, just a quick break, 30-second break, just to recognize our sponsor. And then we come back, we'll, I want you to share with our listeners how they could learn more about, some of your work and authoring. You've authored many books, and I'd love you to share with them how they can get more information on that as well. So my question to all of you is, do you know anybody who may be concerned about an older driver? Well, Senior Care Authority's Beyond Driving with Dignity program is a facilitated self-assessment program for older drivers. This program has been designed to serve as a vital tool to facilitate older drivers and their families as they make appropriate decisions regarding the future of one's safe driving career. If the individual is a safe driver, an advisor will provide him or her with strategies on how to remain a safe driver as they progress through the aging process. If driving retirement is the appropriate decision, then the individual and their family are offered possible alternatives, resources, and a specific plan to ensure a smooth and successful transition from the driver's seat to the passenger seat. So to learn more, you could go to www.beyonddrivingwithdignity.com or call 877-907-8841 to connect with a Senior Care Authority advisor in your area. We're back with Dr. Gary Small, who's the Chair of Psychiatry at Hackensack University Medical Center, and discussing dementia, Alzheimer's, aging, lots of things. So Dr. Small, maybe you could share with our listeners a little bit more about yourself and how they could learn more about the work you're doing, and also share with them how they can get information on books that you've written as well.
So I've spent a lot of my career dealing with aging and how to help people age well. I trained in general psychiatry and then geriatric psychiatry, and was at UCLA for a number of years, ran the university's longevity center and their geriatric psychiatry group, and did a lot of research on Alzheimer's disease, early detection, treatment, and so forth. And during the course of all this, began writing popular books with my wife, Gigi Borgen. And as you mentioned earlier, our book, The Memory Bible, became a New York Times bestseller, was recently released in a second edition. But we've written a number of other books, The Longevity Bible, 2 Weeks to a Younger Brain, books about my most unusual psychiatry cases, such as The Other Side of the Couch, How to Change Your Personality. It's all science-based, and it's all written in a way that the public can understand it. And a lot of it does delve in more detail about how to protect your brain and your body as you age. So if you want to get into the weeds of the healthy brain diet, or how to improve those middle-age pauses very easily with simple memory techniques, I'd refer you to those books. You can check it out on Amazon. It's all out there online. And also, you know, I've done a lot of different lectures and talks, so you can go to YouTube and find my TED Talk on the formula for successful aging.
Great. Well, thank you for that. So I'm sure you get this all the time. I certainly do. Probably a day doesn't go by that either friend or family member, knowing I'm in the industry, doesn't ask the question. You know, I'm forgetting names. I'm forgetting this. Do I have, Alzheimer's? What general statement could you make to people say, hey, there's a difference between age-related memory loss versus dementia or other, dementia like Alzheimer's. And of course, there's a lot of different types of dementia, but people are most familiar with Alzheimer's. But what do you say to those people?
The chances are that you have age-related memory loss. It is normal. By age 45, the average person has a decline in their cognitive ability compared to when they're in their 20s, but it tends to be stable, it tends to be mild. We all tend to joke about these things. Where did I place my keys? You're walking down the hallway. Someone's name doesn't come to you right away. And there are ways to compensate for this. In the Memory Bible, we came up with the shortcut Look, Snap, Connect for these memory issues. Look as a reminder to focus your attention. The biggest reason you don't remember is you're simply distracted. Snap is a reminder to create a mental snapshot of what you want to remember, and that leverages the brain's natural ability to remember visually. And connect is a way of linking up those visual images so they have meaning. If you can make something meaningful, it will be memorable. At a certain age, though, these issues may become more of a concern, and that's when you may want to see a specialist or your primary care doctor to find out if there's something going on that could be treated medically.
Great. Thank you for that. What about technology today, use of technology to, that can enhance or hinder successful aging? Can you talk a little bit about that?
So this is another big area that is quite interesting because it's really taken over our lives. Everybody is walking around with a mini computer communication device, their trusty smartphone. And it certainly enhances our lives. It makes our work and social life more efficient and fun, but it can have a downside. And we've studied it in many ways. I think it interferes with human contact skills. We've done studies showing that you can actually improve the emotional and social intelligence of a young person if you just take them away from their screens for a few days. They're able to recognize the emotional content of the facial expression, social context much better when they put their technology aside. It also tends to affect attention because you're constantly multitasking, and when we multitask, we make more errors. On the other hand, surgeons who play video games make fewer errors in the operating room. So certain types of computer tasks will enhance hand-eye coordination, peripheral vision, and may have some benefits for cognitive functioning. As are other particular games. There are games that can improve what we call working memory, very short-term memory, where you hold information in mind long enough to solve problems. And those games will not only improve your short-term memory, but they'll improve your problem-solving skills. And talking about Look, Snap, Connect and how to improve your memory, there are some programs that can teach people cognitive techniques that can improve their memory performance.
That's great. It's interesting you said about surgeons who play video games. It shows that they, I don't know, I don't remember your exact words, but have a positive impact. As long as they're not playing the video games when they're doing surgery on me, that's all I care.
That could be a disconcerting, I'm sure.
Right. So we're unfortunately, I could talk to you all day on this subject matter, but maybe we could just touch on one more point before finishing up here. And it has to do with just social interactions. I know that my organization that I'm involved with, Senior Care Authority, we work with families all the time and help them find the best places to live and get proper care and all of that. And quite often we run into situations where mom doesn't want to go anywhere. She just wants to be home, and she sits in front of the TV all day and really doesn't have much interaction. Maybe she has an early stage and just doesn't want to talk to other people. And what is your reaction to situations like that, which unfortunately happens all the time?
So people often become withdrawn because their cognitive abilities are declining and they feel insecure in social relationships. But it could also be depression. You become more inward. And I think it's important to assess whether somebody's depressed, because there are treatments for depression that are very effective. It's also important to try to understand or think about what might help the individual become more engaged. What did they like before? Did they enjoy music? Did they enjoy taking walks? And trying to recreate some of those experiences that they liked before they aged and became more isolated. and also to become creative. I mean, you talk to any older adult about their grandchildren, and their faces light up. So spending more time with the family, interacting in that way, spending time with friends is very important to draw people out.
Great. So just any words of wisdom for our listeners who may be confronted with a situation with a loved one, a parent or other loved one, with maybe a diagnosis that they were given some form of dementia, and they're in a kind of an early stage, and any words of wisdom you could give to any family members?
My first word would be, don't do it alone. I mean, it's hackneyed, but it takes a village. It's stressful, the job of caregiving, but there's a lot of resources out there, a lot of people who can help, and a lot of services that are available that can be very helpful. The Alzheimer's Association has support groups that can help caregivers deal with their own emotional reactions. Also, about your own concern, have you inherited this? Are you going to get it? You have more control than you realize. So start living a healthy lifestyle today. It'll make you feel better, and it'll help you become a more effective caregiver.
Great. Dr. Gary Small, thank you so much for joining us on Boomers today. You were a wealth of information. Thank you. And you're invited back anytime. All right. Thank you so much.
I really appreciate it. Thank you.
I want to thank everybody for joining us on Boomers today. We'll talk to everybody next week. And please be safe out there. And we'll talk to everybody real soon.
You've been listening to Boomers Today with Frank Sampson. To learn more about today's show, visit boomerstodayradio.com and join us next time for another edition of Boomers Today.